Hello, welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about bladder leakage for new moms. So, what is normal and what is not normal? I hate that it's still told to women, you went through a pregnancy, you had a vaginal delivery, bladder leakage is expected. That's not normal. It doesn't have to be that way. There's help. So let's talk about when it's normal, when it's not normal. If you had a vaginal delivery, especially, it is normal to have bladder leakage for the first few days and probably the first 2 weeks. So a lot of moms that I see during pregnancy, and I preach these things to them, like bladder leakage isn't normal, they'll call me like a few days after they deliver and like, oh my gosh, I can't control my bladder, I can't make it to the toilet on time, I don't know that I have bladder leakage until I look or feel it. That is normal. So the first few days until the first 2 weeks, I would say you're not expected to have full bladder continence, right? That bladder leakage or not making it to the toilet is normal. That's why in the hospital they give you and your baby diapers, also for the bleeding. And sometimes it's sad. It's like, oh, I thought I was bleeding, but actually I was peeing. So normal for 2 weeks. After that, you should have pretty much full bladder control from like 2-ish weeks on. And by 6 to 8 weeks, you should definitely have bladder control. So in the first few days, don't freak out. It's normal. And it should get better every day and every week. So some studies have been done on this, and this is why this angers me, because oftentimes doctors will tell you at your 6-week checkup, like, just give it time, give it a year. It takes a year to heal from a birth, which I agree. Most of my moms tell me like 1.5 to 2 years, maybe more, depending how athletic they are. But that's like getting your fitness back, not bladder leakage. So they did a study. I will find the reference and link it in the notes. But if you have bladder leakage at 3 months postpartum, they checked women at 3 months postpartum and then at 1 year. And if they had leakage at 3 months, they were most likely to still have it a year. So the evidence, the research, actually shows the opposite of what doctors are generally telling patients. So if you have bladder leakage at 3 months, get your butt to a pelvic floor therapist. Do something, because it's not going away on its own at that point, statistically speaking. Which is why I tell my patients, like, give yourself 2 months, like by your 6-week appointment, things should be generally healed. Like, obviously you're not running a marathon. Obviously you're not like lifting heavy weights, but things should be generally healed. You shouldn't be peeing yourself. You shouldn't have pain with walking. You're probably not having sex yet, but you shouldn't have pain with sex. All those things are abnormal, right? Prolapse symptoms, feeling heaviness in the pelvis. You shouldn't be feeling those after 6 weeks. If so, it's probably not going away on its own. Yes, the body is still healing and recovering, but those clinical signs of something wrong are telling you something's not going to heal on its own. Getting your fitness back, that's a different story. That's going to take time. So if you have bladder leakage at 3 months, you're most likely to have it at 1 year without intervention. So if at 2 or 3 months postpartum you're still having bladder leakage, go see a pelvic floor therapist. Whether your doctor recommends it or not, I can't really say what's legal and what the systems are outside of the US healthcare system, but in the US, you don't need you don't need a doctor's referral to see a physical therapist in every single state and district and territory. You can see a pelvic floor therapist on your own. Maybe you have to pay for it out of pocket, but you can go directly to a pelvic floor therapist, okay? So whatever your doctor says, it's your body, you do what you want. And there also is another study that is really important to me, and it shows a link between, so people who had bladder leakage after having a baby had a higher risk and higher rate of postpartum depression. And I'll link that one in the notes below too. And that makes sense to me. A lot of my patients who have bladder leakage, especially if they have it with exercise or in general, it's like they stop socializing, right? They stop exercising, they stop going out with their friends because they're embarrassed or they're fearful of like bladder leakage showing up. And we know social isolation, it's hard for me to say, increases your risk of depression and postpartum depression and postpartum anxiety. So there is a statistical link in the research. So again, even if your doctor is like, it'll get better in a year, guess what? It's putting you at higher risk of postpartum depression. It's likely not going to go away on its own, but seeing a pelvic floor therapist can help you with these things. Like we can help you learn to exercise again safely, how to like not have bladder leakage. That's our job. And that can also help with your mental health, of course, right? Like nobody feels good if they're worried about their bladder leakage and worried about where the bathroom is and worried about if I'm gonna like pee my pants when I'm exercising or pee my pants when I laugh or I'm not gonna make it to the bathroom. Like nobody wants to live like that. I wish we would stop normalizing it, and I'm hopeful for the next generation with myself, people like me on the internet talking about this. Like, you know, no matter what your doctor says, no matter how knowledgeable or lack of knowledge they have or whatever their personal beliefs are, because honestly, I think a lot of it comes down to their personal beliefs, because they should know about this by now. It's not like some hidden secret. And also, I'm pretty sure, because I've had friends that have gone through medical school, that at least this gets mentioned to them. So they should know this exists, especially the younger doctors. But they still sort of have this belief like, meh, you just are gonna pee yourself. That's normal. You had a baby. No, don't accept that. Go find help. Decrease your risk of postpartum depression, decrease your risk of, this just continuing, and there's help. And I'll link also, I have a free bladder masterclass you can check out. It has some tips in it. I have a paid bladder course you can check out. If you don't have access to a pelvic floor therapist or it's hard for you to get to one, there's things you can do. And it's not just Kegels for bladder leakage. Maybe if you had a vaginal birth, it might be, but there's so much more than just Kegels. For my patients that I see in the clinic, it's never just Kegels. It's maybe Kegels, but maybe they have tightness, right? Maybe they need to work on strengthening their hips. Maybe they need to work on their bladder habits. There's so much more than just Kegels. So that's the hill I will die on. So find yourself help. If you're leaking, it's normal for 2 weeks, and after that, it's not normal. It should be progressively getting better. It should be basically you have full bladder control by 2 months postpartum, and if not by 3 months postpartum, it's probably not going away on its own. All right. I hope you get the help you need. See you next time.